Morning. My name is Dr. Sandeep Pargi. I am the respiratory specialist at Aster Hospital, Mankhool. Today, on a very auspicious day of No Tobacco Day, that is 31st of May, I am going to talk to you about the effects of smoking, vaping and e-cigarettes. And when doctor says to stop smoking, why he says? It's just not that it causes cancer or heart disease, but it has an effect which starts immediately in the sense within few minutes of stopping the smoking. So if someone is smoking and if he stops smoking and decides to stop smoking, the immediate effect after a few minutes is his heart rate starts falling, and after 1 hour his BP will come to normal, and after 2 hours the withdrawal effect starts because your nicotine level in your body tend to go down, and then is the phase when you have the craving. But it's also an important phase. If you overcome this phase, then you are in the phase there where you can start thinking about stopping the smoking. So after the 2-3 hours of smoking stoppage, once the withdrawal effect kicks in, if you control yourself, then the other effect starts coming. Your oxygenation in the body improves, your stamina improves, your lung capacity improves. Like this, there are the multiple effects, depends on the time. If I have to speak about it, it's like in a week your taste improves. In 48 hours your heart rate and BP nearly comes to normal. And if you consider years, the cancer rate comes down to 10% or 50% if you stop smoking by 5 years. So it is a well proven fact that smoking has a bad effect, but stopping the smoking has an equally good effect and immediate effect. So if you are planning to stop smoking, do it right now, because it breaks heart. And the theme of this year is tobacco breaks heart, literally and even medically. Why I say so? Because apart from the commonly known side effects of smoking is being cancer or smoking related lung disease, it also has an effect on heart, which can lead to heart attacks. Now when we know that this has an effect of on heart and lungs and other systems, these days there's a new trend called vaping or e-cigarettes. People think because it is better than cigarettes, they tend to go on to that, but honestly it's not the case. Vaping or e-cigarette has an equal effect. Though there are new vapes which are zero tobacco to 14 to 40%, but even the zero or the 14 to 10% vaping machines have chemical called diacetyl formaldehyde, which are known to cause a condition is called popcorn lung. It's a fancy name, but the effect is not fancy. It can cause a non-infective pneumonia or a BOOP, which we call as, it's a cascading effect of this toxic chemical on the lung, which leads to fibrosis and even a failure of the lungs. So don't think vaping is a good thing. It is equally bad as smoking. Now once we have spoken about vaping and smoking, there is one more important thing we should talk about is Shisha, which is common in GCC. Which people think it's good, better because it's not through the cigarette or it has a filter, but the amount of tobacco or the nicotine is equal or maybe more in some cases. So vaping, cigarette, e-cigarette, shisha, all are the same. They are like cousins. So please refrain from them. Now when we know that these are the effects, how can we get rid of smoking, or how can we quit smoking? The doctor can help you, like physician or the respiratory specialist like me. You can come to us and then we can help you in stopping the smoking and how we can get through this process. I know it's very difficult because smoking is one of the difficult habits to get rid of, but it is possible with self-determination and with help of the doctor. There are medicines like bupropion, varenicline, and very safe and very commonly used nicotine gums. So there are nicotine gums and nicotine patches which can be used to stop or help you in quit smoking. nicotine gum or patches helps in a way that it gives you a sustained continuous amount of nicotine in the body which your body requires, because in cigarettes or other e-cigarette or shisha, you, apart from the nicotine which your body is used to, there are other chemicals which will harm you. So out of the 100 chemicals in a cigarette, the only one chemical or one thing you require is nicotine. So if nicotine is supplied to your body which you are used to, and we stop the other chemicals which are harmful, we can achieve this process of quitting the smoking. So nicotine gum is or nicotine patches releases nicotine in your body slowly, and because the body is receiving the nicotine required for its normal equilibrium or blood pressure or the craving you have, it will slowly help you get rid of the smoking habit, because these gums are not very tasty as such. So but it gives you the nicotine, so you will initially take it, but slowly over the period of time you will stop the nicotine gum also, and hopefully get rid of the smoking habit. And on apart from the medical side, what I have seen through my patient, why they smoke, I ask them why they smoke, especially youngsters. The most common answer is like they feel it's cool, and I don't think so it's cool, and they think it's like the peer pressure or the friends or company colleagues, they smoke and they start smoking. So if you want to look cool, smoking is not the way. You can look in very different ways. So if you are smoking and if someone is smoking with you, say, sorry yaar, I can't come with you, or friend please I can't come with you. Make an habit of saying no for smoking, and slowly the other guy will also understand that you don't have to call him for smoking, he doesn't want to. And suppose if you are already started smoking and if you feel that you need to get rid of it, or if you feel that something has to be done, chewing gum or nicotine gum, have it. Once you take it, that craving of going and taking a butt and have a smoke, just one which will lead to two, will go. So smoking is not cool, please stop it, it breaks heart. As this year's concept says, it breaks heart. Thank you.